My name is Dr. Romy Lauche and I work for the Australian Research Centre in Complementary and Integrative Medicine at the Faculty of Health. My Chancellor's postdoc research project is about the complementary medicine informal healthcare use in older Australian women with anxiety and depression. I'd say it's like the iceberg, you know. Above the water you have all those practitioner-based therapies, but all the other techniques and methods that are used by the patients are actually hidden under the water. Over-the-counter herbal medications, vitamins and supplements, but also yoga classes, meditation classes and things like that. So our project will examine the use of those complementary medicine informal healthcare practices in older Australian women with anxiety and depression. I was working with a lot of patients suffering from chronic diseases, and in that sample those self-care techniques were actually very important. So I was intrigued by those methods. They were easily accessible, they were cheap, but usually they were underestimated. Being able to work in the Australian Research Centre in Complementary and Integrative Medicine is one of the biggest opportunities for me, because ARCM is the world-leading centre for public health research, especially in the field of complementary medicine research. What I hope to achieve with my research is actually to get a better understanding of those informal healthcare practices. And the next step really would be to take those research findings, bring them back to the communities, to the patients and all other involved stakeholders to make a good use of them. Finally, this may end up helping to transform the healthcare system to provide the best healthcare for the patients.